Hello everyone, welcome to our channel Wellbeing by Dr. Amit Malik. I am Dr. Amit Malik, consultant neuropsychiatrist, RTO's Hospital, Panipat. Today we will talk about eating disorders. Yes, a few mothers came with their young adolescent girls complaining that they are not gaining weight and some have habits of vomiting after having food. On detailed evaluation, it was found that those girls are having eating disorders. So, what are it? Eating disorders are persistent disturbance in eating behavior or behavior intended to control weight, which significantly impairs physical health or psychosocial functioning. Eating disorders are basically mainly of two types: anorexia nervosa and bulimia nervosa. Eating disorders are generally found in high socio-economic strata or in affluent families. Few predisposing factors of eating disorders are high ambitions from themselves or pressure of having independence and establishing identity. Few professions are predisposed to having eating disorders. These are fashion industry. Those who are in fashion industry or modeling can develop eating disorder. Other is dancing, belly dancers, and wrestlers can also sometimes develop eating disorders. So eating disorders, as I have already told, that these are mainly of two types: anorexia nervosa and bulimia nervosa. What is anorexia nervosa? There is deliberate weight loss induced or sustained by the patient. In this, there is associated undernutrition of varying severity, resulting secondary endocrine and metabolic changes and disturbance of bodily functions. So, in anorexia nervosa is present generally in adolescent girls and young women, most commonly. Rarely in adolescent boys and young male. Sometimes it is present in prepubertal age also. On the other hand, bulimia nervosa is repeated bouts of overeating and an excessive preoccupation with control of body weight, leading to extreme measures to mitigate the fattening effects of ingested food. What are these extreme measures? Sometimes repeated vomiting, which can lead to disturbance of electrolytes and physical complications. Bulimia nervosa can be a sequelae of anorexia nervosa. So it's generally present in later age, slightly later age than anorexia nervosa. Now we will discuss about diagnostic criteria for anorexia nervosa and bulimia nervosa. In anorexia nervosa, there is body weight is maintained at least 15% less than the expected body weight for the height and age of particular person, or Quetelet body mass index is less than equal to 17.5. The second criteria is weight loss is self-induced, either by avoidance of fattening food or by dieting or by excessive exercise. Third most important criteria is body image distortion, which is always present in anorexia patients. Such patients see themselves as fat or some part of their body as fat. So these dread of fatness persist as intrusive and overvalued ideas. There is widespread endocrine disorder involving hypothalamic pituitary gonadal axis, which in women leads to amenorrhea and in men loss of sexual desire and potency. If anorexia is present in prepubertal age, then it can delay or arrest the puberty. What are diagnostic criteria of bulimia nervosa on the other hand? First is persistent preoccupation with eating and irresistible craving for food, leading to overeating of large amount of foods at present. Then attempts to counteract the fattening effects of food by self-induced vomiting or laxative abuse or alternating periods of starvation or use of appetite suppressants or thyroid preparations or diuretics. In bulimia, there is morbid dread of fatness. Patient sets herself sharply defined weight threshold. So these are basic differences in diagnostic criteria of anorexia nervosa and bulimia nervosa. So we have seen these can be present in particular professions like dancers, fashion industry, and wrestlers also. This can be present. These disorders are present, or these type of symptoms are present, some of your known or family member, then you need to consult psychiatrist for its evaluation and proper treatment. Talking about treatment, anorexia nervosa poses high challenge in treatment, as the anorexia nervosa patient don't identify their abnormal eating behavior as abnormal. Comparatively, bulimia nervosa patient treatment is relatively easy as compared to anorexia nervosa patient. So what do we do in patient? We need to first establish and involve family members in the treatment of eating disorders. First, we correct imbalances, metabolic disturbances or endocrine disturbances, or the complications which arise. Those may be cardiac complications or gastric complication as a result of eating behaviors, abnormal eating behaviors. Then we try to maintain normal eating pattern and try to normalize the weight pattern of the patient. Important is to act on prevention of relapse of such disorders. So by psychosocial model and by pharmacotherapy, we can control these abnormal eating behaviors, which leads to eating disorders and lot of physical and hormonal complication in patient. So if any of your family member is suffering from such disorder, you should go and consult nearby psychiatrist and discuss with them in detail. If you find this information useful for you, you can subscribe our channel, and we will keep sharing important information regarding mental health issues and physical health also in future. Thank you.